Welcome to Pharmacology Insights, where we break down complex pharmacology into simple, easy to understand concepts. Vivid movie-like dreams are a common side effect of certain antidepressants. But what actually causes this? Let's break down the science. First off, what do we mean by vivid dreams? These are dreams that feel unusually intense, colorful, and emotionally charged. They often linger in your head after waking, sometimes pleasant, sometimes unsettling, but almost always memorable. Dreaming can happen in any sleep stage, but most vivid ones occur during REM or rapid eye movement sleep. REM is the final stage in your sleep cycle, occurring every 90 to 120 minutes. As the night progresses, REM phase grows longer, with the last one lasting up to an hour. This means your most intense dreams tend to happen in the early morning. And you're most likely to remember them if you wake during or right after REM sleep. In REM sleep, your brain is superactive, almost like it's awake, while your muscles are effectively paralyzed. This stage is tightly regulated by neurotransmitters such as serotonin, norepinephrine, acetylcholine, and dopamine. So, it makes sense that any drug affecting these chemical messengers, like antidepressants, could change the way we dream. Antidepressants are designed to tweak brain chemistry, especially serotonin and norepinephrine. Selective serotonin reuptake inhibitors, like fluoxetine or sertraline, increase serotonin levels. Serotonin-norepinephrine reuptake inhibitors, such as venlafaxine, boost both serotonin and norepinephrine. Monoamine oxidase inhibitors block the enzyme that breaks down serotonin, norepinephrine, and dopamine, increasing their levels in the brain. These changes can strongly influence REM sleep, where dream lives. In your brainstem, there's a tug-of-war. REM on neurons, using acetylcholine, start REM. REM off neurons, using serotonin and norepinephrine, stop REM. Normally, serotonin helps you fall asleep early in the night, then steps aside so REM can begin. But antidepressants, SSRI especially, keep serotonin levels high around the clock. That means the REM off neuron stays switched on longer. So, the switch to REM or dreaming mode is delayed or suppressed. A 2016 study by McCarthy and colleagues found that SSRIs cut REM sleep in rats by about 84%. Imipramine, a tricyclic antidepressant, also reduced REM, but less drastically, about 69%, and allowed more recovery later. Antidepressants also increase sleep latency in the early weeks of treatment. It takes longer to fall asleep. This is because high serotonin activity keeps the brain more alert, delaying deep sleep, and pushing the first REM episode further back. Here's the twist. When you block REM sleep, your brain doesn't just give up. It builds REM pressure, a strong drive to make up for lost dreaming. When the suppression eases, such as in the early morning, or if an antidepressant dose is missed, REM comes back in longer, more intense bursts. This REM rebound is a perfect setup for vivid emotionally charged dreams. There's one serotonin receptor in particular, the 5-HT2A receptor, that really shapes how we experience sights, sounds, and even mental images. You'll find it in brain areas tied to visual imagination and emotional processing, like the anterior cingulate cortex and prefrontal cortex. These are the same receptors activated by psychedelic drugs like LSD. Chronic antidepressant use, especially SSRI, may increase 5-HT2A receptor sensitivity or density. So when REM rebounds kicks in, your dream imagery can feel brighter, stranger, and more emotionally intense. Almost like a psychedelic trip, playing out in your dreams. Not all antidepressants affect dreams in the same way. SSRIs and SNRIs often cause vivid, memorable dreams. Monoamine oxidase inhibitors, and some tricyclic antidepressants, can suppress REM sleep so strongly that dreaming nearly stops. Bupropion, which increases dopamine and norepinephrine, may enhance dream vividness. Mirtazapine, which blocks 5-HT2A, may reduce nightmares, giving us more evidence of the receptor's role in dream intensity. In most cases, vivid dreams caused by antidepressants are harmless and fade with time. But if they disrupt your sleep or becomes disturbing, talk to your doctor. A change in dose or switching medications may help. So, the next time you hear about vivid dreams on antidepressants, remember, it's a combination of serotonin holding REM back, the brain rebounding, and the 5-HT2A receptor adding a surreal hyper-real edge to the dream experience. And that's it for today's pharmacology video. If you enjoyed this video, please give it a thumbs up and subscribe to the channel for more pharmacology content.